My name is Savannah. I'm 34 and I am from Charleston, South Carolina. I live a very active lifestyle. I'm a mom of two, so we are constantly on the go. Beach, boat, jiu-jitsu. We are all over the place all the time. I love to travel with my family, just adventure, make memories, and blog about it. Fitness really centers me, and so anything that challenges me physically, I love. You name it. Weight training, kickboxing, HIIT workouts, sign me up. I actually started to consider augmentation out of high school. And at that point, I decided to not go forward with it yet since I hadn't had children. And then after I had children, the weight loss, the weight gain, breastfeeding, I found myself at a place where I was looking at augmentation. I wanted to stay a similar size. Like I said, I wanted to complement my body. I wanted to stay in the clothes that I already had. So I just wanted just a little bit more fullness, a little bit more curviness up top. I have an athletic build, and so it just gave me a little bit more curviness up top. After I had my first child, I gained a significant amount of weight with that pregnancy. Breastfeeding, my breasts were very, very large. And once I finished my breastfeeding journey, they then proceeded to deflate, is the word that I would use. And they also became very uneven. So one was much larger than the other, and I actually was not aware of this, that they were so asymmetrical until I saw my before picture from my augmentation, and it was crazy. They were very uneven. I wanted a plastic surgeon that was board certified. I also wanted a plastic surgeon that would answer every single question that I had, whether it was about the size, the risk, the recovery. So I wanted someone that would be very thorough with me. We talked about size, we talked about the procedure, definitely the risk, the complications that could happen, and the recovery. That one was huge for me as a mom. As a mom, I don't have a lot of downtime, so knowing the downtime that I was looking at and going in, knowing exactly the help and support that I would need. I did bring in a couple of pictures of women that I'd found with their breast size that looked like it would be complementary to my body. And I also tried on sizers a lot, a lot before I moved forward. My surgeon did encourage me to feel the implants, try them on, pick them up. I put on a zip front bra and put in different sizes, different feels, and we ultimately decided on the one that complemented my body best. And it was so nice to be able to look in the mirror and see the profile, the size, the feel of the different ones on my body. My plastic surgeon and I ultimately decided on Natrelle. It was the right size for my body, the right feel for my body, and the right profile that I desired. For my recovery, 3 things that were advised to me were to not lift my children, to stay elevated, and to wear a supportive bra. I had a support system in place going in, which is my husband and my mom. They were there. I just took things easy, listened to my body, and listened to my surgeon. And by probably 6 weeks, I was back at it. I love my results. My only regret is I didn't do it sooner. But I am so happy with the look. I think they complement my body, and I do not have any regrets. And just to wear the clothes that I had not felt comfortable in before, and just to look in the mirror and see my body that had 2 children and that I worked so hard for, and just to kind of see what I'd done for myself. I think that as moms, postpartum, what our bodies have done is amazing and it's beautiful. But I also think sometimes there's mom guilt that we kind of lean into. So then when we do things for ourselves, can feel a little bit guilty, feel a little bit selfish. And I absolutely would tell another mom that if this is something that makes her feel more comfortable in her postpartum body and she's doing it for herself, then 100% do it. Have a support system in place, and go in asking every single question. Even if you think that it sounds ridiculous, go in guns blazing with all your questions, talking to your surgeon, and you will absolutely know the surgeon that is right for you. Try on different sizes. Don't feel like you're inconveniencing anybody. It's 100% okay to do something yourself.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertension, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.